So welcome to the first ever New You Saturday morning lecture. I have a huge audience today, so I'm kind of nervous. So the topic this morning is going to be seasonal allergies. And Dr. New is me. Yes, pollen, ragweed, and grasses, oh my. So it's a fitting time of year to do this. So I'm always a person who asks the question what and why. So the most important question is ask, what are allergies? So I think in order to understand allergies, you have to understand a little bit about the immune system to understand what allergies are. The immune system is infinitely complex, probably the most complex system in our body. In fact, we don't understand a lot of it, but we understand enough of it to kind of give a pretty good explanation of what happens in people who have allergies. One of the main components of the immune system is the white blood cells. The white blood cells are kind of the defenders of our body. White blood cells are the primary way that we fight infections. So whether it be a virus or a bacteria or a parasite, it's what we use to protect ourselves. And there's a lot of different types of white blood cells. You can see a couple examples of them here. And each of them kind of have a specific role, but just as importantly, they all communicate with each other. So just like soldiers do on the battlefield, they kind of have walkie-talkies and they talk to each other. So each one kind of a specialized role. So some of them are better at fighting viruses. Some of them are better at fighting different types of bacteria. So you can see a couple of them there. So these are the itchy squad, I like to call them. And the itchy squad is a couple different types of your white blood cells. And the itchy squad is composed of really two types of white blood cells. One of them are called basophils and one of them are called eosinophils. And what's really kind of amazing about this is that they only make up, in total, when you combine those two types of cells, they only make up about maybe 1 to 5% of your total immune cells. So it's not a big percentage. Different types of immune cells are way more numerous. So these ones are pretty rare, you know, in a normal person without any types of infections. It doesn't make up that large a percentage. And their primary function of these two types of cells, at least productive functions, is to attack parasites. Parasites, example of that would be like worms, like tapeworms, insects that would embed in your skin, like ticks. So, you know, in the Western world, we don't really get exposed to this kind of stuff. Yeah. Hardly ever. You know, the vast majority of Americans will never have a parasite, maybe a tick on their skin occasionally, but we don't get tapeworms and hookworms that often. So it's kind of like one of these cells that doesn't really have a role, you know, at least in modern society on a regular basis. But these cells do have other functions, and I kind of call them helpers because they do participate in some other types of activities with other types of infections. So even like a viral infection or a bacterial infection, the common things that we get, they help increase the amount of blood flow to the area to help recruit other cells. So they'll get on their walkie-talkie and say, hey guys, get down here. They prevent blood clotting. They actually have a small amount of heparin in it, which is a blood thinner that helps when you do have increased blood flow. It kind of thins out your blood so you don't get all these big clots. And really the main mechanism by which they do this is a signaling pathway called histamine and IgE. So I'm sure you've heard of antihistamines. Yeah. So that's kind of where that comes from. So histamine is kind of the chemical that is released that says, hey, something's here, we gotta do something about it. So where do these cells live? The first line of defense, we have immune cells all throughout our body. Every single cell, every single corner of your body, there's an immune cell. But they're most numerous, especially these types of cells, and your mucous membranes. And the membranes, the things that kind of protect you from the environment. So your nasal passages, because you breathe in and out, your mouth, because we eat there, your skin, because it covers everything else, your eyes, because you know your eyes are very sensitive areas. So all of these cells are much more numerous in those areas. So that's kind of our first line of defense. And again, you can read through them there. The one I didn't mention would be the lungs, because the lungs kind of are breathe in. You want that to be a very solid area where nothing can get past that. So when you look this is my microscopic picture here. The pink stuff is us. This is our kind of mucous membranes. This would be the barrier. The stuff on the right is them. And on the left, all these different stars basically represent the different types of immune cells. And the stuff on the right is different types of threats. So let's say the black thing is a bacteria, and the green thing is a virus, and let's say the yellow thing is pollen. And we'll talk about pollen and allergens and the role of all of this. But basically, whenever these things come in contact with the membrane, our immune system shifts all the cells over and protects it, which is a good thing. And when that happens, you actually have a little bit of inflammation, and you have a little barrier of kind of mucus that is created. The bigger the infection, the more mucus, the more cells go to that side. So this is what happens in a healthy person. Okay, so back to the itchy squad here. So the itchy squad in people who have allergies, they are, well, like Arnold, a little bit aggressive, a little bit hyper masculine, and they sometimes view things that are relatively not a threat as a threat. So you can see here Arnold looking at this nice, pretty sunflower, and when Arnold sees that sunflower, well, he really sees the predator. So something that wouldn't be a threat, he views as a big threat and a monster. So here's what happens on a microscopic level when the itchy squad sees pollen. So you can see the pollen, a few more pollens have moved over here to the mucous membranes. A lot more cells that really don't need to be involved get involved. And so you have this whole pathway of things that happen. So you have swelling. As you can see, it's gotten more red, it's gotten larger. And the other thing that happens is that little tiny mucous membrane that kind of protected this gets a lot bigger. This could be snot. So if this is the inside of your nose, this is snot. And as you can tell on the right side, the open air that you should be breathing in your nose has gotten squeezed really, really small. So there's your mucus there. You have an increased amount of blood flow, and that's kind of what causes the swelling. And there's actually a term for this process. No matter where it happens in your body, whether it happens on your skin, whether it happens in your nose, whether it happens in your lungs, this is called atopy or atopic disease. So allergens, you guys could probably name a lot of these, but pollens are a huge one. And it doesn't matter where the seed or the pollen comes from, grass, flowers, ragweed, mold spores, dust mites, cockroach, dander, pet dander, primarily cats, different foods, different environmental things. So even like chemicals in the air, if you get exposed to too much car exhaust, that can be a trigger for this. That's a little bit different, but those are the primary ones that bother people. So what happens in atopic disease in each of these specific areas? This is a really important concept because the exact same pathways that cause atopic disease, depending on where they happen, is the name of the disease. So if this process happens in your nose, we call it allergic rhinitis, which basically means seasonal allergies. People have stuffy nose. Happens in your eyes, the itchy, watery eyes, we call that allergic conjunctivitis. If it happens in your mouth and your throat, it's called allergic pharyngitis. If it happens in your lungs, it's called asthma. So a lot of people don't realize that asthma and allergies are the same exact process. One happens in your lungs, one happens in your nose. Some people it happens in both. Some people it's just one or the other. If it happens in your skin, it's called eczema or atopic dermatitis. Yeah, these are all the exact same, for the most part, the exact same pathway and the exact same process. It just depends on what part of your body it happens in and what we term it. So allergy symptoms. So if you've ever had allergies, you could probably name every single one of these. But sneezing, runny nose, congested nose, itchy, watery eyes, sore throat, coughing. Coughing is kind of a complicated one because it's kind of caused by a lot of those other things, but also just direct irritation of your throat can cause coughing. If it's bad enough, it can lead to congestion of your sinuses and pressure and pain, puffy eyes, ear pain and pressure. If you get enough swelling that your ears can't properly regulate their pressure, then pressure builds up and you get pain there. And over time, it can cause something like hoarseness. So this is a big concern for people. How do I know if it's a cold? How do I know if it's allergies? Because a lot of the symptoms are very similar, and even for a doctor, sometimes it's not black or white. But there's a few key things that I look at. with allergies, you won't have a fever. And by fever, I mean like a legitimate fever. 101, 101.4 is technically a fever or higher. So, if you have a temperature of 99, it doesn't mean that it's not a cold. It just means not sure. But if you have a temperature of 101, 102, it's allergies cannot cause a temperature that high alone. Typically with allergies, you won't have muscle aches, you won't have soreness. You can get fatigue if it's chronic allergies. Yeah, much more likely a viral infection if you have like muscle aches and muscle soreness. This one I put a star on. The traditional teaching is that with allergies, your mucus secretions are more clear. With infections, whether virus or bacteria, they're more yellow and brown and green. I don't think that necessarily holds true all the time, because it depends on a lot of factors. If allergies hang out long enough and your mucous membranes kind of get inflamed for a long enough period of time, even allergies can cause yellow and green, and because it's really just a matter of if the mucus sets there long enough. So a lot of times people say, well, I know I have an infection because it's yellow or green. It's not really an indicator of an infection or allergies or bacteria or virus. It doesn't mean probably as much as what we think. In allergies, typically your symptoms will last longer than 7 to 10 days. So a virus, common cold, it really shouldn't last more than 7 to 10 days. Your body will fight it off. But allergies, as long as the pollen is in there, as long as the allergen is exposed to you, then you're going to keep having symptoms. And the other big thing is over your lifetime. I've heard people say, every March I get a cold for about a month. You hear that story. Not to saying that can't happen, but if there's a very seasonal timing to it, and it happens every single year at the same time, you should probably think much more about allergies than a cold. Yeah. Complications of allergies. And this is an important point as well. So whenever you have a lot of congestion and swelling in your nose and your nasal passages, it can lead to a whole other host of things. And people who have allergies are much more likely to get infections from like a bacteria, for example, because if you can't properly drain your sinuses and you can't properly drain your ears, you're set up for a bacterial infection. So people who have allergies are much more likely to get a bacterial infection in their sinuses or in their inner ear. That's the two big ones. Having said that, it's not always the case just because you have symptoms in your sinuses or your ear that you have a bacterial infection. And again, that kind of goes back to the whole fever and a whole other host of things. Sleep disorders are very, very common in people who have allergies, because if you can't breathe right through your nose, then you snore. You tend to sometimes even develop something kind of like sleep apnea, where you stop breathing in the middle of the night, your oxygen levels drop, so that can cause all types of bad things, even something like high blood pressure, of course, fatigue. So it's, allergies, although they're a nuisance, they can lead to really serious health problems, especially in kids.
Are you sure you're not an allergist?
No, I'm not an allergist.
What?
Diagnosis and testing of this. For the most part, this is a clinical diagnosis. You don't need a bunch of blood work to put the pieces of the puzzle together and for your doctor to make a diagnosis of allergies. So really what you're looking at is your history. So they'll ask you a bunch of questions, your medical history, and then an exam. There's certain findings when the doctor looks inside your nose. And trust me, the doctors don't like looking inside your nose. They do it for a reason. It's not for fun. There's certain appearances of the membranes that look more like allergies than an infection. And so they'll kind of put all those things together and say, this is probably allergies. Some lab work. So there are some general lab work markers in your blood that can indicate this is more of a allergy than a viral infection. So sometimes you can use those. You can look at the blood cell counts. As we talked about, there's all different types of blood cells, and sometimes not everybody, but a lot of people who have really severe allergies, those blood counts will be abnormal. So the basophils and the eosinophils, and then also that IgE marker will be way high in someone who has really bad allergies. So if you're kind of on the fence about it, you can always order those tests. So allergen testing, this is always a hot topic. Should I get tested to see what I'm allergic to? As you can see from the picture, there's dozens of possible allergens. This is a panel that the lab that I use, this is the standard stuff they order. And I'm not going to go through each one of these, but it basically includes almost every common tree, a lot of different grasses, different pets. So there's, I think, over 18, 20 here, something like that. So there's a lot of different stuff you can test for to see specifically if you're allergic to that thing. The most traditional method of doing this is called a skin prick test. And the skin prick test is the most widely accepted method of doing this. So basically what you do is you take each of those little things from the last slide, and you take a small amount of them and you inject them just under the skin. And you mark with a number you can see on his back there. He has different number markings. And so you inject a small amount of that stuff, and then you wait to see if they react. So it's a fairly labor-intensive process. And basically if you get a welt, then you're allergic to that thing. And so they can actually, you'll come back several hours later and look at it and say, well, this guy right in the middle of his back, whatever number that is, he's really allergic to that with those big welts. There are other ways of doing this. There's something in the blood that they can the IgE thing that they can actually measure in a lab. So they draw blood from you, they send it off the lab, and they mix it with all these different allergens, and they see which ones. Historically, that has been not a very accurate way, and most specialist allergists are somewhat skeptical of this method, probably for good reason. The old tests were really inaccurate. They didn't match up well with a clinical history. There are some newer techniques and newer methods that are much more accurate, and I think at some point they'll get to the point where that is possibly the standard, or at least very well accepted. So the good thing about it is it's a simple blood draw. You don't have to get pin cushioned and then sit there for hours and get really uncomfortable. It's just a simple blood draw.
That's what I like about the 21st century. There's a lot of technology.
Yeah, technology is definitely cool, and I hope that at some point that technology becomes good enough, and there's really enough research to really back that up. And I think that there's going to be very soon, if not already. So what's the use of doing all of this? Does it matter if you know that you're allergic to the elm tree and to this flower and to that flower? I mean, what are you going to do about it? And is it worth doing all of this for? There's a lot of different reasons why you might do this. So lifestyle choices could be one of them. And one of the most common things is people are like, well, am I allergic to my cat? Am I allergic to my dog? And, there's two ways to find that out, but probably the easiest is to do this testing. I mean, you can get rid of your dog or cat, but the allergens from your dog or cat will linger for months or years. So you may have to wait 6 months and clean your house from top to bottom, and still 6 months it's going to linger. So you don't know for sure on something like that. So if you're trying to make a decision about whether to get a cat, whether to get a dog or get rid of one, that's certainly a reason to do it. If you know the specific tree and pollen you're allergic to, you can actually look at the pollen forecast and figure out which ones are high that day, and maybe say, I'm not going to do my gardening that day. And you can actually look on the Weather Channel, and they actually will list these. Yeah, and it's really cool. They have online now, they have a pollen forecast. They'll actually say which pollens are high that day. So you can actually somewhat plan your day to a certain extent around that. If you're wanting to live in a bubble, you can say how big a bubble. If you're allergic to 14 things, you need a huge bubble. But probably the most common reason that this is done is for allergy shots, because you need to know what you're allergic to in order to do that type of treatment. Allergy shots, the broad term for this is called immunotherapy. So immuno means immune system, therapy means treatment of your immune system. So you're not treating the symptoms, you're actually trying to modify your own immune system. And the most common way this is done is allergy shots. And it's really as simple as taking all of those things, really, really small amounts of those things that they did the skin prick testing with, and inject them into you. And the theory is that over time, as you build up the amount of allergen you inject, your immune system, the itchy squad, ignores it. So it kind of develops a tolerance to it. It's almost the exact opposite of what a vaccination is. In a vaccination, you inject the flu virus, and you actually cause an increased response, and so that whenever you get exposed to it, you can fight it off. This is actually the exact opposite. And so over time, your body kind of doesn't freak out when it gets exposed to pollen.
You develop a tolerance for needles too. I had those shots.
Yeah, and maybe you will develop a tolerance to the actual shots. You won't feel them anymore at some point.
Yeah.
And that's an important consideration, because the standard protocol for this is to do it once a week for about 6 months, sometimes a little bit less, sometimes a little bit more, but most people do about once a week for 6 months in a row. And it's usually, it has to be at the doctor's office. And one of the main reasons that is because you're injecting something in that you're allergic to. And there is a small chance that there's a severe allergic reaction. And that doesn't happen very often, but it is a risk. Success of this, well, that depends on what you define as success. Total resolution of symptoms is probably not that high, maybe 50%. But a lot of people have a reduction in symptoms, so they have less runny nose, less trips to the doctor, and depending on how you define that, maybe upwards of 80% success. Once you go through the protocol, however long it is, a lot of people will do pretty good for about 3 to 5 years. Some people longer, some people 10 years. Kind of depends on your immune system, but it's an investment, and it usually lasts. If it does work well for you, it can last for years. There are other types of immunotherapy or allergy treatments. In Europe, actually, they use these drops in your mouth. They're called sublingual drops. You drop them under your tongue. It's the same theory, and they absorb into your body. These are kind of like the blood test for allergy, the allergy test. It's really not the standard of care in the United States. There's some debate about how effective it is. They're trying to develop the technology better. But there are a lot of research that shows that it does work. The biggest difference is you have to do it more often, but you can do it at home safely because you're not going to get the huge immune response. You don't have as risk of severe reaction. It takes a lot longer, though. I mean, you have to do this for years. And by years, it could be 2 years, could be 5 years. It's really unknown. And there's a lot of different formulations. But you can get it done in the U.S. So the question is should you get this done? Should you get the allergen testing, or should you get allergy shots? It depends on a lot of different factors. It depends on how severe your allergies are. I mean, if you have mild allergies that don't really interfere with your life, it responds pretty well to the standard treatments, which we'll talk about. Depends how much of the year. If you have 3 seasons out of 4 seasons that you have allergy symptoms, that's a lot bigger deal than having it in March and April. So it kind of depends on all those factors. Then you always have to look at the cost and convenience. I mean, a lot of people just can't go get allergy shots once a week for 6 months. I mean, I would have a lot of trouble doing that. So you have to look at all of those factors. And so avoiding allergens, I should say. So this kid come up with a bubble, and he's leading an active life. So that's certainly an option for some people, but I don't recommend that. So really can't avoid allergens. I think of it as maybe reducing the amount of exposure that you have to them. And there's a lot of different techniques you can use. And a lot of people who've come to me, they've taken all the different medications, but they've never really been educated about how to reduce their exposure to them. And that's a hugely important thing. And I think about it like this. If you get a cut on your arm that's dirty and nasty and has dirt in it and nasty stuff, and you go to the doctor and they say, here's an antibiotic, and they never wash out your cut. I mean, no one would ever do that. The first thing you do is wash out the cut. And that's kind of what, the allergies are like, because you want to not just treat your body's reaction to it, but reduce the amount of allergens you're exposed to. So there's a couple different things. Masks when you're mowing or cleaning, they don't have to be a fancy mask, but those ones that fit fairly good on your face. I know it doesn't look cool. It may not be the most comfortable thing in the world, but if you're doing something where you're going to be exposed to a lot of allergens, wearing a mask can be very helpful, especially when you're cleaning dust or something like that. Showering. Showering patterns are something that a lot of people don't think about. There's 2 recommendations that I have with that. If you've been outside working, mowing the lawn, you need to assume that you're contaminated. Go inside, take your clothes off, preferably not in your bedroom, take them off, bag them up, bring them to the washroom, and take a shower. Rinse your hair off. This is especially important in women because they tend to gather a lot more allergens and dust in your hair. You can't see it, but it's there. So, just go right inside, shower, get rid of all that stuff. Your bedding, and I underline this one for a reason. Hopefully you spend at least 8 hours a night in your bed, if not more for some people. You want to make that area as allergen-free as possible. So that needs to be like a sacred zone. There's a couple different things that are important. One is washing your sheets frequently. I mean, once a week. I know my wife probably don't do that, but at least once a week, if not more often. But really the main thing is trying to keep the allergens out of there in the first place. So never lay down in your bed with your clothes you've been wearing all day. Keep your pets, even if you're not allergic to the pets, keep your pets off your bed, and if even better, keep them out of your bedroom. Try to keep that area as allergen free as possible. Air filters, we often.
I wash my sheets once a week.
Good for you.
Yeah, that's incredible.
Changing your air filters is something that most people don't do often enough. There's actually a HEPA certification, and HEPA basically means it's a really fine mesh, and it will catch, standard ones really are too big and too porous to catch all the different tiny little pollens and allergens. So you have to get a HEPA one, and I would change those every 2 to 3 months. I mean, that's, again, something that most people can't keep up on, but set a calendar, circle in your calendar, and do it. Windows, this is kind of an interesting one because it depends on kind of what you're allergic to, what to do with your windows. If you're really allergic to pollens and you have a lot of bushes or outside your window, it's going to go right through the screen. Having said that, you also don't want your house to be too damp, because dampness tends to make things like dust mites and molds grow more often. So it kind of depends on what you're allergic to, what to do with your windows. But in general, you want a well-circulated house, but you don't want tons of outside stuff blowing in. Pet control, this is really tough because what really causes the allergen in cats and dogs is not their hair, it's their skin. So a lot of people believe that if they brush their dog enough or their cat enough, that they'll avoid it. But it's not the fur that you get off on your little fur brush, it's the skin. It's the dander, not the fur. So that one's really tough, but do what you can to avoid that. And there's really no way to get rid of the skin cells that slough off. There really is no such thing as a hypoallergenic dog. They sell them as that. There's no such thing as an allergy-free pet. So I'm not sure how that all got started, but I think it's probably more of a marketing thing more than anything else. Dusting is really important, especially people who have allergies to dust mites. You need to dust often and do so wearing a mask. Okay, so removing allergies. So you can't avoid all this stuff. So once it gets in your nose, and your ears, and your eyes, what do you do about it? One of the products that I really like people to use is a nasal rinse. Most times people think of the neti pot when they think of this. And this is something, there's a couple different brands of it, a couple different ways you can do it. But basically you're taking a large volume of solution that's has some salt and baking soda in it that kind of neutralizes it, and you squirt it up your nose. And it's not a necessarily pleasant thing, it's not painful, but you do have to kind of get used to it. And you typically stick it in one side, stick it in the other side of your nose, wash everything out, and you're basically just reducing the amount of pollens, all those little things we saw on the screen with the tissue there. You're trying to wash all that out. The thing that you have to understand about this is this needs to be a daily routine during allergy season. A lot of people expect that they have terrible allergy symptoms, they're all stuffed up, and they try this twice, and they say that doesn't work for me. Well, if you're all swollen and your nose is all plugged up, it may help a little bit. It'll wash out the mucus, and you'll see a bunch of snot in the sink. But the real mechanism or real theory behind this is to wash away all those allergens. So I've heard a lot of people say, I tried that, didn't work. Well, how many times did you try it? Well, I tried it once. It's not like a pill that you can take and just you feel better. Some people do. I actually feel better when I do it. It tends to kind of unplug some things. But for the most part, this is something you need to do every day, like brushing your teeth during allergy season. And, once a day is fine. If you've been outside and had high exposure, you may want to do it, if you mowed the lawn or whatever, especially if you don't wear a mask. Oh, yes. Distilled water, because tap water has a lot of stuff in it that can be very irritating. Tap water has chlorine and other chemicals that can just cause irritation, especially when you're doing it every day. I don't know if you guys have heard in the news about how deadly neti pots are. There was a big story about 2 or 3 months ago that several people have died, and they associated this with the use of these devices. Most likely what has happened is that the people have used some type of contaminated water source. So tap water is relatively clean, it's safe to drink, but it's probably not safe to blow up your nose. Whenever they test the tap water, there are microscopic organisms. There's one in particular called an amoeba, and these amoeba, if they enter through your nose, that's how they infect you. it can be deadly. I mean, it is deadly, 100% fatal. It's very uncommon, but you can avoid that risk entirely if you just use distilled water, because distilled water is not necessarily sterile, but it doesn't have any bacteria, even trace amounts in it. So I buy a jug of distilled water. There's no risk of those type of weird infections, and it's not as irritating. Yeah, I typically try to get it lukewarm, and you can do that a couple different ways. Usually what I do is I fill up my jug, I get warm water running, and if you see the jug back here, I put lukewarm water, I put my just room temperature water in the jug, and then I'll either fill up my sink or just run really hot water over the top of the thing. So I'll kind of heat it up just slightly. The other thing I've heard people do is they stick it in the microwave for about 10 seconds. So you don't want to singe your nose, you want to feel it before you put it up there, but you'll kind of figure out how many seconds in the microwave, and you can put those in there for 5 or 10 seconds. It'll just heat the water up, and basically that's just for comfort. It makes it feel more soothing, and cold water is kind of a little bit of a shock to squirt up there. I know lots of people who use tap water. I don't think it's Russian roulette, but they're in Louisiana this year. There were at least 2 cases, and this is probably because Louisiana's. Yeah. So I don't think it's like Russian roulette to use tap water, but I think it's probably advisable to use distilled water. Yeah, I've used tap water when I've used mine before too, so I've done it. It's better to use distilled water. So allergy medication. So these are the things that most people rush to first, and basically all of them, in one way or the other, are toning down the immune response. There's a variety of different mechanisms by which they do that. Reducing inflammation and swelling. They reduce the mucus secretions or dry you out, as people say. So there's a couple different options, and these are in really no particular order. Probably the most commonly used allergy medications are antihistamines. And the older antihistamines, which are very sedating, something like Benadryl, is very cheap. Don't need a prescription for it. I don't like using it during the day. It makes me kind of drowsy, but at night it's an okay medication to use. Again, very, very affordable. The newer antihistamines are non-sedating. This is something like Claritin or Zyrtec or Allegra, or I don't know what else they're going to come up with. And there's some differences between those different ones. Some people swear by Zyrtec, some people swear by Allegra. I don't know if a lot of scientific research shows there's a huge difference between them, but they all work kind of similar. Some of them are more expensive. Allegra tends to be the more expensive one. Claritin's probably the cheapest one. Generics are just fine, and you can get generic Claritin in bulk for probably $3 a month, so it's very affordable. Nasal steroids, something like Flonase, is a nasal steroid that's squirted directly up your nose, and it's very effective. In fact, that may be one of the first line things I recommend people to do. That when you need a prescription, it's a little bit more expensive. The generic Flonase is about $25 a month or so if you use it every day. Anti-inflammatories like ibuprofen and naproxen, this is something that most people don't use. And this can actually be very helpful for people with the swelling that I mentioned. It can actually reduce the amount of swelling and help you breathe better. Sudafed, something very commonly used. Basically, you can either get just direct pseudoephedrine. In Kansas, this is behind the pharmacy counter. So if you buy the Sudafed that you don't have to ask the pharmacist for, it doesn't have pseudoephedrine in it now. So there's brand name Sudafed, but Sudafed may not have pseudoephedrine in it, which is very confusing. One of the rules is anything with a -D after it, so Allegra D, Claritin D, Zyrtec D, that's Sudafed in there. Fairly, if you get just strict pseudoephedrine, it's maybe $5 a month. If you get the combination ones with the Allegra or the Claritin, it may be a bit more expensive. Another medication that's prescription is called Singulair, more commonly used for people with like severe asthma, but it can be used. In fact, I think its first use was for allergies. It works totally different than all these other medications. It's really kind of a neat medication. Unfortunately, it's very expensive, about $150 to $200 cash if you're paying for it. There should be a generic of it, I believe, sometime soon, but it'll still be $100 or so. So I don't use it very often because it's just so expensive. You hear people getting steroids. So I talked about the nasal steroids, but you hear a lot of people say, I get my allergy shots. And usually what they're talking about is they're getting injected with a steroid into their muscle. I don't use those very often. There's a large number of side effects from using steroids. If you use them occasionally, it's not a huge risk, but there's certainly more risk if you give an injection in the muscle, depending on which type of steroid, it's going to linger for 2 to 3 weeks. It's really good at reducing inflammation, but it also has a lot of other side effects. It raises your blood sugar, all other types of things. So I don't use it very often, but sometimes if it's really bad. Eye drops, I could give a whole lecture on eye drops. There's tons of different kinds, but you definitely should talk to your doctor about using eye drops, because some of them, if used inappropriately, can cause a lot of bad side effects. Other treatments, so not just allergy medications. There's a couple different things I'd like to mention. Vitamin D, which seems to be a cure-all for everything in the world now, which makes me think that it's not. But there has been some research that shows there's an association between people with allergies and asthma and being low in vitamin D. Is it the chicken or the egg? Is it real just a correlation, or is there a causation there? I'm not sure. But there's some people thinking that if you give vitamin D supplements, that some of these people's symptoms may get better, and some research backs that up. So it's a safe medication. In fact, I recommend a lot of people take vitamin D anyway because so many people are deficient in it. But it is something to think about. There's a ton of different herbal medications. Probably the one that most people have heard of is something called stinging nettle. People who are into herbs know that one very well. And it actually, when they study these, there are actually several of them that show they do have some type of relief when people take these. Some of them are actually mimics of antihistamines. So if you actually broke them down and purified it and looked for the mechanism, some of them actually have an antihistamine property to them. So I'm not an expert in herbals, but I know there are some things out there. I much would rather have the purified antihistamine than all the other stuff that comes along with it, but it is an option for people. Acupuncture, strangely enough, there's some research that shows that acupuncture gives people relief. I don't know how solid the evidence is, but I don't think it's probably harmful, and some people say that it really helps them, so something else to consider. So medication strategy. So I listed a billion different options. It really depends on the person. There's a different way to approach this, but different people will use different methods, kind of depending on their medical history or their medical problems. So you may end up taking a variety of different combinations. Some of the medications you have to take daily. Sometimes some of them you can just take as needed. Depends how severe it is. But the main thing is you consider the cost and the side effects and your other health conditions. And with your doctor, you can come up with a good plan. So that's the end. So probably way more than you ever wanted to know about allergies. There is a lot of information.